Ocala's information station, 1370 WOCA. Ocala.
All right, 5 minutes after 11 o'clock. Thank you for tuning in. Each Thursday for the last few weeks, we've been speaking to Dr. Jayanth G. Rao about cancer, about radiation therapy, and et cetera, et cetera. Dr. Rao is on the phone again. And remember, the conversation that Robin and I are having with the doctor is also an invitation for you to have a conversation. If you have a question about cancer, this is a good time to call. So let me give you the phone number, and then we'll get to you as soon as we can. The phone number is the WOCA Climate Control Source Hotline, 622 WOCA. If you're out of the area, and I do see some viewers on the streaming video thing, who knows where you are? You might be out of the area. So the area code is 352, and the rest of the number again, 622 WOCA. Dr. Rao is a board-certified radiation oncologist, the medical director of the Florida Regional Cancer Centers, and his credentials are outstanding. He does work here in Ocala as well as over in Beverly Hills, in Citrus County. And Dr. Rao, we've got so many things to ask you already this morning. Good morning. You're on. Good morning, Doctor.
Good morning.
Wow. I don't know how you get time out of your day to talk to us, but I'm glad that you do.
It's my pleasure. Thank you.
There was one thing, and I know we want to talk about gastric cancer a little bit. Tish had called me, but I wanted to ask you something if I could squeeze it in real quickly. There's a public service announcement that's been sent to the radio stations, and it's also apparently on TV. It's the actor Mark Harmon, and basically what he says is that if we boost our immune system, and I'm not so sure how we do that, whether it's with drugs or with lifestyle, but that we can actually prevent cancer if we strengthen our immune system. And I wrote this down, he credits the information to the Society of Clinical Oncology Conference, I guess something that happened last month. Mm-hmm. Can you talk about that a little bit? I guess the reason I found it interesting is because I didn't think our immune system had anything to do with cancer.
Well, it does. It does. If you think about it, I mean, cancer is multifactorial. It's not one cause that leads to cancer. You know, we talked, I don't know if it was the last time or the time before that there are various factors in the environment that lead to cancer, that may lead to cancer. The DNA within each cell of us has to go wrong, whether there's a break in the strands of the DNA due to bacterial infections or viral infections or radiation from the sun or the food we eat or the things we do like smoking, etc. Mm-hmm. All these contribute in addition to, of course, what we derive from our parents, genetics. So there are multiple factors. It's not one thing. What tends to happen is in all of us there is constant bombardment of our cells. And you've heard a lot about, these products that are sold in the open market, and also people send you tapes saying that oxidizing agents, destroy your cells and permit aging process to go on. Therefore, if you use antioxidants, that you would do better. And a lot of these vitamins, etc., that are sold, it's a huge, huge market. Oh. Now, it is true that our immune system comes to our rescue all the time. Whenever things go wrong in the body, even if a cancer cell forms, most of the time it doesn't come to the surface because our immune system is repairing the damage. But only when the immune system gets overwhelmed, cancer develops in its full form. So yes, it is important, but how do you boost the immune system? Your initial question. Yeah. It's not easy. The body does. The body is a fantastic machine. There's nothing like it. Can you do something to boost it? Well, it's very hard. Not at this time anyway. And that's the reason why all the focus on cancer management in the future is going to be on how to manipulate the genes, how to prevent the cancer, before the cancer actually develops, because there are so many factors that come into play. Can you boost the immune system? Yeah, through vaccinations and all that. That's essentially what immune system is all about, to make your own body aware of the fact that these cells can be recognized
Right.
And
And I guess the reason it was confusing is because, I mean, we're always told that cancer is not contagious.
it's not. It's not infectious. I mean, it's something that you develop. Not all of us develop cancer. Some of us do, some of us don't, and that's because our immune system is strong enough to destroy the cancer cells. So, yes, that's true.
It's interesting. I mean, I'll have to look at the PSA again and try to figure out if maybe it's not trying to encourage us to buy a supplement or something. In other words, it's not really a PSA. Maybe it's an ad of some sort. But
Right, absolutely.
well, anyway, that's interesting stuff. So somebody, just one more thing about that. Somebody who has an immune system problem like AIDS or HIV or lupus or something like that, I think that's in the same category, they are more susceptible to cancer?
Yes. Remember last time we talked about association between cancer and arthritis?
Yes.
And we talked about breast cancer and arthritis. We talked about rheumatoid arthritis, which is like lupus. It's an autoimmune disease. And lung cancer and melanomas and myelomas and all different types of cancer that are associated with autoimmune diseases.
Right.
So yes, there is, whenever the immune system, or even when people undergo transplants of the kidney and whatnot, they're given certain drugs, so that the body doesn't mount a reaction against this transplant. And that also may lead on to, when you're suppressing the immune system.
Oh, wow.
So it could.
So you got to be careful.
Yeah.
When a person is diagnosed with cancer and then they have the radiation and things, and then all of a sudden they're deemed cancer-free, are they allowed to donate blood?
Yes. It's not contagious, like I said. You are allowed to donate blood, but obviously some of these rules have been written many years ago, and sometimes, the blood banks have in their list, and they say, did you have so-and-so treatment, chemotherapy, or whatever, so you can give blood. Sometimes you may come across that, but truly it should not affect, the blood that you give. I can remember one time I wanted to give blood, and I'm very healthy, fortunately. But I lived in England for about 10 years in the 80s.
Yeah.
And in their list was one thing that said if you lived in Europe, you can give blood, particularly in England because of mad cow disease.
Right.
And I don't even eat beef. And they wouldn't want to take blood from me. So some of these things are written long time ago, and it makes no sense.
We donate blood. I had, I think I mentioned, a little bit of skin cancer on my nose, and I could not donate blood for, I think it was a year.
Yeah.
And I never understood the connection.
No connection at all.
All right, gastric cancer, the digestive system in general, right? Does it include the liver?
Gastric means stomach.
Only stomach?
Yes.
Okay.
So it's stomach cancer. That's what basically gastric cancer is all about. Now, yes, it can start in the stomach because of the proximity of the stomach to the small intestines. After the stomach is the first part of the duodenum or the first part of the small intestine, and then, of course, there's loops and loops of that. Tucked away in that reverse C, where the first part of the small intestine forms, is the pancreas, and next to it on the right side is the liver. So all these structures are nearby. Therefore, why am I talking about that? Cancers, by proximity, can extend from one area to the next, just by extension itself. Not to talk of spread through the blood, spread to the lymphatics, which are the other routes of spread.
And is that the same thing as metastasize?
Yes.
It's the same thing,
yes,
okay.
It's the same as metastases, but different modes of spread.
And when a person has been, quote unquote, cured of cancer, sometimes they're told that it might recur in 5 years, that's the span that they give. Is that across the board?
Not across the board, no. There are some people who have, for want of a better term, a cancer gene. They have more than one cancer in the same individual. But that's rare. But not necessarily just, say, for example, a person develops breast cancer. It doesn't mean to say that that person will develop another cancer in 5 years. Not at all. Now, that 5 years and 10-year thing has been applied for treatments such as radiation. Sometimes I'm asked that question. patients say, I've heard that radiation can cause cancer, so why are you giving me radiation?
Right.
Yeah, right.
You know, so, and again, the percentage is so small, and it takes a good 10 years to develop, if at all. If you are in that small percentage of patients, then it takes good 10 years to develop something like a blood cancer called leukemia, and which is more common or more readily caused, and about 20 years or more to develop a solid tumor. So solid tumor is a true cancer as you and I know it. So if I have a 70-year-old or a 75-year-old, you know, with a certain cancer, and I'm only treating a limited area of the body like the prostate or the breast or whatever, does it matter if they happen to be in that list of 2% of patients or whatever who may at the age of 90 develop a cancer? What is important? Do they want to live now, or should they be worrying about whether or not they will develop cancer at the age of 90 or 95?
That's a good point, yeah. What I want to ask you, going back to the gastric cancer part of this, when I was a kid, my dad had a bleeding ulcer, and it sent him to the hospital, and from what I remember, he almost died from it. Could an ulcer lead to cancer?
Sure. In fact, most gastric cancers they look like ulcers, and it's sometimes very difficult to distinguish a benign ulcer from a cancer. That's why biopsies are done, even on an ulcer, to rule out cancers. And there are many various types of gastric ulcers and gastric cancers. But yes, it's a fatal disease. It's less common. About 25,000 are found in the United States, out of which 14,000 deaths occur. More common in the black population. More common in the males versus the females, in a ratio of 3 to 2.
Is it because of what we eat?
Again, that's true in certain parts of the world like Japan. Salted foods, nitrosamines, burnt foods. When you barbecue and burn them up and eat burnt foods, there's a lot of nitrosamines. The Japanese tend to use a lot of salt preservatives, and lack of refrigeration, lack of intake of citrus fruits or vegetables and things like that may lead to gastric cancer.
Oh my goodness! So now we know what to eat and what not to eat.
Yeah.
Right.
I'm wondering. The story I was just telling about my dad was in the '60s, probably in the early '60s, and so I'm wondering if they even knew back then to do a biopsy, or because I remember they took a large part of his stomach out. That was what because I was a kid, so it trickled down to me that way. Is it possible that back then they just took it out and didn't even realize it was cancerous?
How long ago was that?
In the mid or early 60s?
I'm sure they knew something about it, and I'm sure they would have biopsied. But the mainstay of treatment for gastric cancers is surgery, where you remove a major portion of the stomach and connect up with the intestines. So that is still the treatment of choice in the vast majority of gastric cancer patients. One of the problems with gastric cancer is that by the time a patient has presented to the doctor, it's more than an early gastric cancer. Only about a third of them usually present in the very, very early stages, and they are the fortunate ones. The vast majority present with lymph node spread, and therefore you're chasing the rainbow.
And so what would we look for? Is there a pain? Do you have like a bellyache, or does it give no symptoms at all?
There are vague symptoms. You can have weight loss, nausea and vomiting, anemia, just unexplained anemia, and some people may even present with, vomiting of blood called hematemesis. So any of these symptoms related, vague symptoms like weight loss and anemia, one should immediately get a gastroenterologist to check out both ends and see if there is some bleeding leading up to that anemia, and the weight loss is related to that. So any vague symptoms like that, even pain sometimes.
Why is it that sometimes people will have an unhealthy lifestyle? They smoke, they drink, they do this and that, and they're 100% healthy and cancer doesn't appear. But somebody that has the perfect lifestyle and does all the right things, cancer appears.
Yeah.
Well, sometimes it's luck of the draw, as we call it, but Usually, it's not true that people with an unhealthy lifestyle escape. It catches up with them sooner or later. But yeah, those people sooner or later will have problems. It could be cancer, it could be heart disease, which is more common than cancer. Whatever they pay the price for it.
Yeah.
The unfortunate ones are the good ones. Why do they develop cancer? And that is exactly what I was saying. It's multifactorial. Could be genetics. Could be multiple factors that we don't understand today.
We do have a phone call. Dr. Rao is our guest right now, and your phone calls are invited. We ask you to ask questions of the doctor by calling the WOCA Climate Control Source Hotline, which is 352-622-9622. Good morning. You're on the air with Dr. Rao.
Yes, good morning, doctor.
Good morning, sir.
In regards to prostate cancer, the treatment was radiation only. A period of 10, 11 years has passed. Would a person at that point feel to be in the PSA readings are very, very low, very good? Is a person could they consider a cure situation at that point?
Sure, yes. See, right now, today, what we do, whether you have surgery or radiation, the two main forms of treatment for prostate cancer to effect a cure. Surgeons would say if you live 10 years, because that's the mark, 10 years, you're considered cure until proven otherwise. In other words, even after 10 years, you may develop metastases or something. You can never say never in medicine.
Yeah.
And the same thing applies to radiation. There is no difference in the ultimate outcome, whether you have radiation as a primary treatment or surgery to remove the prostate, provided you pick your patients right. All prostate cancers are not the same. Some are early cancers, and that's where there is some debate as to whether they even need treatment. And then there is the intermediate grade. Definitely they need treatment because they may go on to develop a more aggressive cancer. And of course, the Gleason score and the PSA sometimes determine you have an aggressive cancer from the word go. And the ultimate result depends upon the stage of the cancer that you present at. If after 10 years, I'm assuming you had an early cancer, and you've been treated appropriately and you've not had any problems and your PSA is less than 0.5, which is my criteria, that you're doing well, then of course you may consider yourself cured because you have to at some point in time have a cutoff. Even though one can never say you will never get cancer back again, it may happen, but still 10 years is the limit.
With radiation treatment, because the prostate is still there, you're always going to have somewhat of a PSA reading. Is that true?
You can, because there is normal cells and there is cancer cells.
Yeah.
See, how radiation works is you're treating the whole prostate. And when you treat the whole prostate, you're taking advantage of the normal cells that have a capacity to regenerate in course of time and produce PSA like they did before. The cancer cells do not have the same capacity to recover or regenerate.
Yeah.
They die.
Yeah.
So that's what you want. Yes, you will have some PSA output because of the normal cells.
Is the PSA the only reliable test to be done at this point?
Unfortunately, that's the only thing we have right now.
Yeah.
In the future, maybe it'll all change, but right now, that's the only thing we have after treatment.
Okay, thank you very much.
You're
Thank
welcome,
you.
sir.
Thank you for the call. And we do have another phone call, Doctor. Good morning. You're on the air with Dr. Rao.
I'm sorry, I've got the wrong number.
Okay, all right. That happens sometimes with live radio, Doctor. If you're out there and you would like to call, you've got about 7 minutes left before the doctor has to move on and do things, I'm sure, the very important things with people who are right now hoping that there's a cure for cancer soon. I'm guessing this is a daily thing for you, people just asking you, is there any hope for a cure?
Yes. See, we're doing a lot better than we did about, let's say, 10, 20, 30 years ago. 50% of the cancers, according to the American Cancer Society, can be cured. And again, it depends on how you use the word cure.
Yeah.
We said in prostate cancer, 10 years is considered optimal. In lung cancer, it may be 2 years. In breast cancer, it's the same as prostate cancer. So, and stomach cancer, if you've lived 2 years or beyond, like lung cancer, you've done well.
Oh, wow.
So it depends on the type of cancer, the stage, and whatnot. Yes. By those criteria, you may be considered cured. see how they sometimes they compare this with the actuarial analysis, depending on your stage, how long you're supposed to live, versus with the treatment. If you can reach that, the same stage, then of course you've done very well.
I don't know if we ever shared this with you, and I know it's real personal for Robin, but her husband had a lung removed because of cancer, and how long has it been now?
3 years now.
3 years.
Okay.
His whole left lung.
So you just said good news. That was good news for Robin to hear.
Yeah.
Yeah, that's right. Pneumonectomy, it's called. Sometimes if it's in, there are 3 lobes in each lung. And if the cancer is kind of situated somewhere between the lobes, sometimes, just removing one lobe at a time may not do it. A whole lung may be removed, if provided the other lung is healthy and can take over the function.
Yeah.
And people can still function well.
Wow, that is good news. Good morning. You're on the air with Dr. Rao.
Good morning, Doctor.
Good morning, sir.
I can barely hear the doctor. I can hear you good, Larry.
You might be able to hear him better now that you're on the air.
Okay. My brother-in-law had prostate cancer. He lived in California. He went to a cancer center and discussed the various means of treating it, and they sold him on proton treatments. He asked about seeding, with radioactive seeding, and they told him that the seeds could migrate to his lungs and brain, and they didn't recommend it. Is that true?
Wow.
Well, how much time do you have?
I can't hear the doctor.
Try it again. He's asking you how much time. Try it again, doctor. He couldn't hear you.
How much time do we have for me to answer this question?
Oh, I'm sorry. You got about 5 minutes.
Okay. Can you hear me now? Can the caller hear me? All right. There are various forms of treatment with radiation. Let's talk about radiation since you brought up proton beam therapy. Proton beam therapy is a form of radiation which was used experimentally in some large centers like say in Massachusetts and also in San Francisco for many years for research purposes. Lately in Loma Linda, California, a few years ago, they introduced proton beam therapy to treat certain cancers. The reason it was introduced is because proton acts precisely to treat a point in the body, like at the back of the eye if there's a lesion or a cancer, to shoot it down without damaging other parts. Similarly, in the spine, if you have a cancer, you don't want to damage the spine, you just want to treat that cancer over there. Those are the indications for proton beam therapy. Then came prostate. Does it make sense to treat prostate with proton beam? Probably not, because it's very expensive. It costs $67,000 for the treatment schedule with proton beam therapy.
Gosh.
There is no advantage whatsoever over and above, let's say, what you mentioned, seed therapy or external beam radiation called intensity modulated
Excuse me, doctor, but is it true that radioactive seeds inserted into the prostate can migrate to the lungs and the brain?
Yes, to the lungs have been seen. I have pictures when I do lectures. I show them. I also show pictures of seeds sometimes migrating into the rectum. It depends, you see, on the doctor who's doing them, how good they are at doing them. A lot of people have jumped on the bandwagon about 10 years ago and started doing seeds without much experience, and they have much poor results compared to the experts in the field.
Oh, wow.
And yes, migration of seeds is a possibility, but it doesn't happen all the time. There's another treatment which I started in the Northeast and my colleagues in California that's called high-dose radiation, where you don't leave the seeds in the prostate. You basically, it's a stronger seed soldered to a wire. You send that to treat the entire prostate and you take it back. So there's no chance of anything migrating. And that's something I've done for several years. I've done about 800 of them, and we have excellent results with it. But today, we don't need to do any of those invasive procedures. You can do non-invasively treat with intensity modulated radiation or image guided radiation treatments. The technology is so fast changing every 5 years or 10 years that you don't have to go backward. It used to be the seed therapy used to be the way to go about 10 years ago. It's not anymore. And certainly proton beam therapy is not the best option. There's no advantage.
Okay, well, thank you very much.
You're welcome.
Yeah, the good news here is that you're here, and the news you just told us about the fact that it depends on how good the doctor is.
Yeah.
That's scary stuff. I mean, we got to know who we're going to. So
Yeah, unfortunately, the patients don't know, and you can't find out either because a lot of them are jumping on the bandwagon and doing certain things because it's the in thing.
Mm-hmm.
And the training that they receive, and I won't mention names, it's like looking over somebody's shoulder and watching it twice and coming back and doing them.
Oh, no, that's not good. Well, that's why we are hoping that this little radio segment reaches the people who need to hear it, whether they live here or they tell somebody else they love who doesn't live here to come down here. Not that we want to keep you ultra busy, but I guess you're one of our only hopes. Well, that's the good news. I guess a real quick question, maybe it's an obvious one, going back to the gastric cancer. We often associate lung cancer with cigarettes and smoking. I'm guessing that cigarettes can also contribute to gastric cancer?
Gastric cancer is mostly with, it's seen in certain occupations. Rubber industry workers, coal mining, asbestos workers, infection with a bug called Helicobacter. And that's why today even ulcers are treated with an antibiotic. There is a condition called achlorhydria where there is less acid output to digest the food. There is a condition where there is B12 deficiency called pernicious anemia. All these lead to gastric ulcers and gastric cancers. So, and I mentioned about lack of refrigeration, smoked and salted foods, low intake of fruits and vegetables. All these also add to it. Now, smoking has not been one of the precipitating factors.
I guess I was just being a layperson trying to figure it out. Because, I mean, when you smoke, you swallow. You don't swallow smoke necessarily, but you swallow whatever's on your tongue at the time,
Yeah.
But, yes, other cancers of the gastrointestinal tract, like, starting from the tongue all the way down, larynx, esophagus, and then bladder can be caused by smoking.
Let me give out the phone numbers so that our listeners can call you, and correct me if I'm wrong. I want to make sure that my notes are right. In Ocala, it's 352-291-2495, correct?
That's correct.
And Beverly Hills, it's 352-746-1100.
That's correct.
That's the Florida Regional Cancer Centers, by the way. Please call us if you need those numbers repeated. We'll give you the addresses. In fact, Robin already has it on the WOCA.com website. Doctor, we're always all ears when you're on the phone. Thank you for doing what you do.
Thank you, sir. Thank you.
Always a
My
great
pleasure.
show.
Bye-bye.
We'll be right back.
Habitat for Humanity of Marion County is a ministry dedicated to improving lives by providing affordable and decent housing. Help them help others by visiting the Habitat for Humanity Ocala home store on Northwest 27th Avenue. To schedule a donation, give them a call and they'll come and pick it up. For more information, visit habitatocala.org. Habitat for Humanity of Marion County, building homes, building hope, building community.
I'm heading down to Daytona, where it all begins.
Hear that? You could be going down to Daytona for the hottest races this summer.
Where the track is really fast.
The Firecracker 250 on Friday, July 5th, and the Coke Zero 400 Saturday, July 6th.
Start the season even.
And all you have to do is register for your chance to win at the following locations.
Heading down to Daytona.
Baseline Auto Sales, 2501 Southeast 58th Avenue on Baseline Road. Brick City Health and Fitness in the Pine Plaza on South Pine.
The super speedway.
And at the home games for the Ocala Stampede played at Trinity Catholic. Each sponsor will have 2 tickets for each race, and the drawings will be held Friday, June 28th. There's no obligation to enter, so you don't need to be present to win. And enter as often as you'd like. You're always a winner with WOCA The Source, and you could be...
Heading down to Daytona. Heading down to Daytona. I'm heading down to Daytona.
How good does it get?
Golf has long been considered to be sport's most prestigious game, and WOCA has your connection to everything in the golf world. Every first and third Thursday at 10 a.m., tune in for Let's Talk Golf with your host, PGA professional and teacher to the stars, Jim Beckett, and operations manager for the links of Spruce Creek South, Darren Irwin, right here on The Source.
Here are today's headlines from the source WOCA. Law enforcement officials are asking for help in identifying two men accused of robbing another man near the Marion Theater in downtown Ocala Tuesday evening. According to a report from the Ocala Police Department, officers responded to a call from the Starbucks restaurant at 36 South Magnolia Avenue from a man who said that he was walking and texting on his cell phone on Southwest Fort King Street when someone punched him in the face. He said he fell on the ground and then another man took his wallet and stepped on his face. According to the report, both men ran away. The victim described one attacker as possibly Hispanic with a goatee who was wearing a pink T-shirt and black cargo shorts. He said the other man is possibly white, was clean-shaven with short hair, and was wearing a Gator T-shirt. The victim was taken to a hospital for evaluation. Anyone with information can call the Ocala Police Department at 360